Hi, everyone. Thanks so much for joining today's webinar. My name is Beth O'Riordan, and I lead commercial content marketing here at Best Buy Health. We're so thrilled to have you for our webinar, which is Earning While You Help, a Smarter PERS Referral Opportunity for Brokers. Oops. So today we're going to first hear from Scott Hartley, who's the Director of Health Plan Sales here at Best Buy Health. Scott's going to provide a brief overview of the Best Buy Health's Broker Referral Program before introducing our guest speaker, who's Elle Massey. She's the independent insurance broker and agency principal at Elevate Insurance. She's been participating in the Best Buy Health Broker Referral Program, and so she's going to share her insights and why she's passionate with you. We're going to end today's session with a Q&A with the audience. So if you do have any questions during today's presentation, please feel free to type them into that questions box on your screen, and we will get to as many questions as time allows. Lastly, we will be recording today's session, and we will be distributing that recording in the next few days, so please look out for that. And one more thing, there is a post-webinar survey. We value your feedback so, so much. So please take a minute to fill that out. It's 4 questions, super quick, and we will look at every answer. And with that, I'm going to hand things over to Scott.
Thanks so much, Beth, and thanks to Al for joining me today, and thanks to all of you for being on the webinar. I'm really excited to share with you a little bit more about the Broker Referral Program. It really started. The impetus was the of the program was really from feedback about brokers and their interactions with their members and the tough situations that they were finding some of their members in. And that really stems from some of the dynamics that are happening within Medicare Advantage today and the personal emergency response benefit being pulled from many plans across the industry. And what that's doing is that's leaving a lot of members with unable to access the benefit through their health plan. So we really created this program for you all as an opportunity to provide some value back to your clients. And really at a high level, how it works, Best Buy Health, we've been providing personal emergency response services for over 20 years. We have a long history in helping members stay safe and independent in their homes. So how the program works, it's a simple referral program. We provide you access to a referral platform that allows you to share that information with your clients for them to purchase PERS through you and through via our website. In doing so, they'll receive a discount and you'll receive a commission. So it's really an exciting program. We think it's a win-win for everybody involved. I'll jump a little bit into the details and we'll obviously share this deck with you after the webinar. But how it works, we have a link to sign up for the program. All you do is enter in a few pieces of information and that will create your account. On the right side, you'll get access to your dashboard once you create that account. And what it'll do is provide you with a referral link. So you can see that blue link there. That is going to be what you share with your clients. When they click on that link, that's going to punch them out to the lively.com page. Lively is our brand for a personal emergency response, and that's where they can transact and purchase it. If they purchase it through your link, that will automatically apply the discount code for them, and that will automatically track the commission so that is paid back to you. We also have several marketing resources available within the portal. So you can see there over on the left, there's a tab that says marketing tools. That'll give you access to several different pieces of information that we find have been very helpful to brokers who've participated. The first is a getting started guide. That's a little bit about how the program works and how to get started. The FAQs document, and this is a kind of ever evolving document as we continue to get more questions from brokers on, hey, it'd be really helpful if you provided this piece of information. This is going to be your kind of one-stop shop to get you educated about the program and how it works and the service. We want to make sure that you're confident and comfortable when you're in front of your clients telling them about the PERS service. We have a member-facing flyer as well, so that's customizable. So you can put your own referral QR code. You can put your information, your company's information, and share that out with your clients. And then we have some email and social posts. Obviously, you can edit those, but that's a way to drive awareness of this program for your clients. We actually just hot off the press introduced a new piece of collateral that's available within the marketing tools. And this is really a conversation guide. So we recognize that talking to your clients about PERS is and can be a very difficult conversation. And it's one that, if not gone down the right path, will, can feel uncomfortable. So we've gotten a lot of feedback from the broker community about how to approach this topic and this subject with your clients. And we've put this together in this piece of collateral. Finally, I wanted to call attention to the July promotion that we have going on. So for each referral and sale that's completed for the month of July, we've doubled the commission from $25 to $50. So we've already seen a lot of you, or a lot of brokers, take advantage of this promotion already. So it's great to have some additional money in your pocket. And as currently stands, the member discount is obviously continuing on, and that's at 50% off of the device. So we're excited about the July promotion. There will definitely be more promotions to come. So as you sign up for the program, please make sure to take a look at the emails that we send out, as we're constantly doing promotions and providing you with new information. Now that's a little bit about the program itself and how to get signed up. There's a lot of information online, and you can certainly reach out to myself or the team at any time, and we can answer any kind of programmatic questions and sign up questions. But I'm really thrilled to be joined by Al. Her and I have had a few conversations about her experience with the program, and some of the stories that she shared are really touching. So we thought we'd invite her into the conversation and just kind of share with you her experiences with the program, and how talking about her clients and sharing the personal emergency response program. So Al, I'd love to kind of bring you into the conversation and just have you introduce yourself and share a little bit about your background and your work as a broker.
Thank you so much. It's such an honor to be here. Um, as you can see, my name is Elle, and I began my career as a Medicare broker, as a captive Medicare broker for one of the largest insurance companies in the country. I'm sure we can probably guess one of the three biggest. So I handled the inbound call line, and I had the chance to speak with probably over 30,000 Medicare beneficiaries in my time with Humana. And I became independent a couple of years ago and founded Elevate Insurance because I felt like I wanted to be able to offer more than just one carrier. And really, throughout my career, I've really delved into not just writing a plan, but helping people understand their coverage so that they could be empowered to use all of it, in explaining Medicare Advantage to a client. So that's kind of what brings me here.
Thanks so much for sharing that. What you've obviously been a part of the program for the last couple months, and have shared this with your clients. Can you just tell me a little bit about the experience that you've had in talking to them about this program and about personal emergency response?
Sure. Well, my experience with the Best Buy program and your affiliate marketing link has been amazing. All of the technology and user friendliness that Best Buy brings to the table is very evident in that affiliate page. And when I got the email from Best Buy Health several months ago to be offered the opportunity to do this, I was so excited because um, I always covered the PERS whenever I presented to a client when we had it available in Medicare Advantage plans. And I would develop my relationship with the client as I was presenting their plans. And at the very end, I would say, now we've discussed all of the benefits of your product, everything to do with it. You understand the copays and the benefits and the extras and everything. Let me give you the most important piece. And it's the part that hopefully means it will help you, empower you to use your whole plan for as long as possible. And that is the personal emergency response system. And I would explain the PERS and what it meant, and that it's that button you press in case of emergency. And they felt seen and they felt empowered, and they called and they ordered the PERS from their insurance company. So that meant a lot to me. And just before I got the invitation from Best Buy to participate in this program, a family member of mine had fallen from a ladder. She was the picture of health, absolutely fit as a fiddle, could run circles around the rest of us that were half her age. But she was painting a wall by herself in her home, and she fell off the ladder. She was deeply injured, and she did not have her phone near her, and she did not have a personal emergency response device. And unfortunately, she was unable to receive help for 4 hours after her injury. So this was personal to me because I thought through all of the times I had talked to my clients about this and how life-saving it really is. And here I am looking at my aunt who is recovering in a skilled nursing facility from her serious injury and how close it came to her not being able to get that help in time. And so it was personal. And I jumped at the chance to be able to offer the PERS because I've told all of my clients and family and their children about this product because it's so truly life-saving. So that's part of why I have such a passion for this is it's personal.
Yeah, I think that's, one thing that we find is talking about personal emergency response isn't always an easy conversation. I don't think anybody kind of wakes up and gets out of bed and thinks, I really want to go get a PERS, but we see time and time again that it can be a true lifesaver. So, are there any kind of tips and tricks that you have of how to approach a difficult conversation or what may be perceived as a difficult conversation with one of your clients about PERS?
Yes. I talk about it being peace of mind. In their pocket, on their wrist, around their neck, clipped to their belt loop, on their purse. Um, Peace of mind, not just for them, but for their beloved family members who care about them. I highlight the technology that ties the purse to an app that the family members of the person who has the account can see so that in the event of an emergency, their family get a push notification as well. And I talk about how many things Best Buy Health does to support members, that it's not just about pressing a button in case you need someone. It's there if you need support in so many ways, someone to talk to, someone to help you understand the terms on, whether it's to ask a question from a nurse, a question about a medication. Best Buy goes so far further above and beyond the extra mile to support members. I really cover the ease of the technology, the safety and peace of mind, the fact that it's there and hopefully you never need it, but that your loved ones can look after you, even if they are not right there with you. And that has really resonated with clients.
That's a great point, Al. And we have been on a mission, ever since Best Buy Health started to really break down some of those preconceived notions about what personal emergency response is and what it is not. And as you mentioned, we say internally you can push your button for anything, and that's what we tell all of our members on our service. Only about less than 5% of the calls that come into us are actually emergencies that we need to get 911 involved and dispatch. Um, the most common thing that members connect with us for is just because they want to talk to somebody. They're lonely. They need to hear a human voice, and they push their button and they connect with one of our caring, empathetic care center agents on the other end of the line. And just knowing that that human being is there whenever they push their button and connect is a really kind of powerful message.
It really is. Scott, I'm licensed in all 50 states plus Washington, D.C. So I have clients literally from coast to coast. And I can tell you that and actually, I work completely virtual. because I am licensed in all 50 states. I have clients who ask if I can do a house call, and I'm like, might take me a couple days to get out to you. But uh, I specialize in that empathy. It's what is the golden thread that ties together my work as a broker. And my clients feel that from me. And when I share the empathy that Best Buy's putting forward here, one of the things I do is I go to the videos that are on Best Buy's actual customer facing site because I took some time to become educated about this before having the conversation with my clients. And it really is all there, either within our affiliate portal or on Best Buy's site, presenting the lively, including this incredibly heartwarming video that talks with the and interviews with the people who are on the other end of those phone calls and how many stories they've heard and seen and the ways that they make a difference to clients. That just, I already feel so strongly about this and passionate about supporting my clients with it. I think this is a spectacular opportunity for us as brokers. But I fell head over heels in love with the team that has been listening to these calls and they're on the other end because it really is about more than just emergency response. They build relationships of trust, empathy, compassion, and service. And it's very clear. They hire for it, they cultivate that relationship within their team, and you can tell they care about what they do. It's really inspiring.
Yeah, that team on the front lines is really our secret sauce, and we value them so much. There are, and one of the things that we do that is different from many of the other PERS providers out there is our caring centers. First of all, it's in the name. We call them caring centers because that's truly what they are. They're not, it's not a call center, it's a caring center. We have three of them based in the US, and they're all W-2 Best Buy Health employees. Many of the other companies out there are outsourcing that function. We feel very strongly that they are the ones interacting with the members in their time of need. And we want to have the most highly qualified, highly trained people that are on our staff. One stat that I love to call out is the average tenure of our frontline caring center employee is 4 years. Anyone that knows anything about running a traditional call center, the turnover is very high. We value the fact that our people stay with us for a long period of time and really get to know those members and provide that support. You mentioned the videos and some of the other things that were on the site. Any other ways that you got yourself up to speed on the service so you felt comfortable talking about and standing behind the Best Buy Health Personal Emergency Response Service?
Well, I watched the FAQ evolve. Every time I turned around and logged back in, I could see more FAQ answers because you guys have been listening to us as brokers. I studied the materials that are provided for us as brokers, the resources about how to present it. I love this new conversation guide, and always when I get questions from my clients, I then go back and research them. I write them down. If I don't know, then I'll email or I'll review the FAQs. I read every word of the Best Buy Lively offer. And I just, just like we would with any other Medicare plan. And of course, we take AHIP and we recertify every year and recontract and appoint with all of our carriers. Product knowledge is highly important. We are very good at it. We do it a lot. So it is very clear and able to be found. And that was what was really great, is that I didn't feel like this was a hard learning curve to be able to talk about, especially after talking with my clients and hearing their biggest concerns.
Is it something that you have shared with all your clients, or how do you kind of feel out, is this a right client to share with or not? And is there any kind of um, kind of pre-work that you do going into those conversations. One thing that we thought about is the hundreds of thousands of clients who used to have access to personal emergency response through their MA plan that, all of a sudden, going into 2025 and 2026, it just disappeared from their plan. And that was kind of a starting point. But I'm wondering how you kind of work through who to talk to it about and maybe who isn't a right fit.
Sure. Well, I have Medicare marketplace slash ACA, individual and family, and property and casualty clients. So my first pass was to send an email sequence of about 4 emails to my Medicare clients. And it was kind of an outreach to say, this is something that's very personal to me as your broker. You've entrusted me with your coverage for your Medicare plans. And I did send it to both Medicare Advantage and Medicare supplement clients. I have about a 50-50 mix. Medicare supplement clients had not had the PERS usually. It's not generally available in a med sup. So I've opened it up as more of just a this is available. I have the opportunity to get you a discount on it. Let's have a conversation. Here is the link. Please give me a call or an email and let's have a conversation. And I will give you feedback on this. My Medicare clients choose to talk to me rather than click that link, even as easy as it is. And so user friendly, they would prefer to talk to their broker, a person. And that has sparked the conversations. And I've had them send the email to their children. Their children call me. They say, my daughter handles all my technology. I don't do that phone stuff. I don't like email. They want a person to walk them through this. And I am more than happy to be that person because when I sell a PERS or I help someone make the decision, it's not about me, it's about them. It's about establishing that peace of mind and safety. And that builds so much more trust for me with them because they feel my presence as I'm not trying to sell you something, I'm tapping you into a resource that I am so delighted to be able to offer you at a discount off of retail.
Yeah, no, that's really good feedback and good conversations. And one thing as I look at the some of the questions coming into the chat, there's questions around the cost of the service. The discount applies. It's 50% off of the cost of the device. The retail price is $80, so 50% off is $40. And then the monthly is $24.99. Within the FAQs document, we mapped our price to the other competitors in the space, and we are the lowest priced service in the market, and especially kind of what you're getting for our service. How does the conversation around price go, and is there things that you kind of bring up around the value that you're getting with the service?
Yeah, I love that question. I just had this question from one of my most, shall we say, frugal clients. Very frugal, like pinch that penny, and that's great. Love it. Got to let that retirement last as long as you live, right? Got to make sure those pennies stay in your pocket, but very frugal. She called and she wanted to talk about this, and she did not scroll down to see the pricing of the plan, which, by the way, is on the PERS site. You can see it. If you scroll down, you can see what monitoring plans are available, and you can talk about that. That is one of the most common conversations I have: is how much does it cost per month? She asked that, and I was almost flinching as I said $24.95 a month because she hates subscription services. I know her well. And she said, oh gosh, I thought it was going to be like 50 or 60 a month per person for myself and my husband. And I was like, yes, because she was thrilled that the service begins at $24.95 a month rather than twice that. So I felt like the fact that it is Best Buy and it has that embedded trust factor of being one of the premium services in the country for technology, it's such a great deal. And it actually is very doable for many clients.
Yeah, we thank you for that. I think as the industry has evolved, there's really been a lot of competitors who have taken their prices up and who have, quite frankly, um, in our mind, taken advantage of people in vulnerable situations and charged a higher price than really is, is needed. And that's where we like to come in and provide the best value we can and provide a rate that's affordable. So as you mentioned, within the FAQs document, we have our price compared to some of the well-known players in the space, and that's the facts. And the other thing that we like to highlight too is there's no contract. So many of the other personal emergency response vendors out there will lock you into a year, 2 year long contract that are very difficult to get out of. Ours is month to month. So we see sometimes clients' lives change. They move into a higher level of care, into assisted living, and they have full-time staff and don't need the service anymore. And instead of, charging them some sort of cancellation fee or not letting them out of their contract, ours is a month-to-month service so they can get out at any time, which is, we think, the flexibility that means the most for those clients. I know we're running short on time, and I did mention there's a lot of questions that came into the chat, and we're not going to be able to answer them all, but we'll be sending out a recap of all the questions after this call. But with the last 3 minutes, Al, I love to just turn it over to you for any kind of parting thoughts for the group on the program and the value it's added for you and your clients.
Absolutely. I'm just endlessly grateful for this opportunity. It has opened up so many important conversations, opened the door to discussions about the ever-present understanding that is needed to educate people on custodial care, long-term care, life insurance, how to utilize their Medicare plans, what the gaps are in coverage. This is a very important tiny gap that we can absolutely fill with this. I feel like that it's such a gift that Best Buy has offered this to us. It's quite exclusive because this is not a commonly understood aspect of care. By having these conversations and by opening the door to this discussion, I believe that it will on the long term build trust, stronger relationships, um, help us have conversations with people who may eventually become or who are already the power of attorney, the caregiver, the loved ones of our aging clientele, or those who absolutely need this because of disability. This is not just for Medicare beneficiaries, it's for everyone. And we don't have those. Barriers anymore. We have the chance to make a difference here. Um, I can't tell you the conversations I've had just from that simple email sequence and the phone calls where when I'm presenting a Medicare plan, I just say, and by the way, one of the other aspects that I handle is to make sure that every gap is covered. How important is a personal emergency response device to you and to your family and loved ones? And I sit and I wait and I let them share. And the stories that are told, the trust that is established, the relationships that are deepened from that. To me, that is why I do what I do as a broker. It's why I care so much about my clients. And it just means the world to me to know that by this is one more chance for them to have um, the life-saving technology in their hands, on their belt, or around their neck that could save their lives. So thank you again to all of you at Best Buy Health for giving us this opportunity. I can't wait to see where we go with this. I can't wait to see this program grow to hundreds and thousands of brokers nationwide. And I am here to testify that it is awesome. I'm also willing to have conversations. If any of the attendees here today would like to reach out, I would be happy to have Best Buy share my information. You can email me or give me a phone call, and I'd be happy to talk with you a little bit more about the program if you want to have a one-on-one with me.
Thanks so much, Al. It was a pleasure having this conversation with you. I didn't think I would meet anybody else that was more passionate about PERS than myself and my colleagues, but you have surprised me in that, and we really appreciate it. We're so happy to have you along for the journey, and everyone on the call. We are happy to have you as part of the program as well. Um, as we wrap up, again, as Beth mentioned early in the call, we'll be sending out a video of the call, the recording. If you joined late, you can catch some of the things we talked about in the beginning. We'll also be sending out answers to all the questions that we weren't able to get to in the chat live. And I encourage you all also, if you have additional questions, to reach out to myself personally, or it's great that Al offered up herself to field questions as well. So please feel free to reach out. This is truly a service that can be a lifesaver. It can also just be a opportunity for members to just connect with that live human being who can be there whatever their needs may be. So we appreciate everyone for joining. Thanks for taking the time, and hopefully we hear from all of you soon.
Thank you so much.
Thanks.